everyone, this is Melanie Capel. I'm here with a really good friend of mine, Karoline Tran. Caroline, thanks so much for taking the time.
I'm happy to be here.
So, a lot of people haven't had the pleasure of getting a chance to meet you. So, can you just start off with a little bit about who you are, your experience, and then who you are outside of work?
So my name is Karoline Tran. I am currently Chief Quality Officer at Sala Integrated Services. We are in FQHC. Previously, I was with IH. I was their Director of Operation and Informatics. And I have been with an FQHC for around 10 years and with PACE with just a little bit over 4 years.
That's great. Yeah, I remember when we first met at our first MPA, I feel like you were very enthusiastic about like informatics and all of the things that you've done, especially with your FQHC experience. So one of the things I really want to get to, just because this is really about PACE, is what brought you into PACE in the first place and what made you stay?
So I was actually with the Orange County Public Health doing vaccination. I was at a really stable job at an FQAC, and I left during the pandemic because I was telling my spouse, like, everybody's, sick and like dying, and I can't just sit in an office. So I left my very, very stable job and went into the field. So I was with the County of Orange for a little bit over a year. We did a lot of vaccination. I was with a lot of POTS. And then I met one of my really good colleagues from there. And at the end of, when things were kind of wrapping up, he decided to go to PACE. So that's where I kind of interviewed and met folks at PACE. And I did not know a lot about PACE at the time. And I was applying for clinic manager. But at once I went into the interview, I was super happy to kind of hear about the model and I loved it. And they called me back and they said, well, with your experience, we don't want you as a clinic manager. We want to hire you in for informatics. So I was happy to be able to kind of use both side of my skills.
Do you feel like you were always like a data informatics person, or do you think it was kind of PACE that pushed you into that?
I think it was a little bit of both. When I was at the county, I was doing a lot of the vaccine allocations, so it's definitely a lot of the informatic part. But with PACE, I think I get to do informatic, and then I get to see the progress with the patient and really work with the participant. So definitely kind of bring out the clinical side of me, actually.
Yeah, no, that's awesome. I feel like I could totally, knowing you personally, I feel like I could definitely see how that's like part of your personality as well. So one of the things that I really want people to get out of this is just really getting a deeper dive into other people's experience. There's a lot of people that I'm sure you've met and I've met that have been like, is it me that's really the only person experiencing this? Like almost a need for validation. And so, what's something that you feel like would surprise people about PACE or working within PACE?
Yeah, so the system that PACE uses, that whole person care, having a lot of discipline, kind of working together to care for folks, it's not a brand new model. So you see it in the hospital system, you see it in outpatients sometimes. Outpatients sometimes lacks the patient navigator part of things, but definitely you see it in a lot of hospital complex system. But at PACE is you can actually see it. The model of PACE really embraced that and actually put it into practice. So I think something that I personally was very surprised when I went to the interview and was able to like ask questions and learn more about PACE is that, oh, the system that we've been talking about forever is actually at play. So it's really great to see.
Yeah. Do you feel like there's this disconnect between information, between having been in FQHC, the hospitals, and all of that? Like, what do you feel like are some methods or techniques people could use to kind of bridge that gap in understanding about PACE?
And currently, at least my FQSC, we're trying to do a lot of patient navigation, try to really embrace that whole person care. But when you come to PACE, there are the gaps that has to be addressed. So the PACE system already addressed it because out in the outside system in the FQ, for example, I'm gonna have to go look for my patient navigator, go look for my case manager. You don't have to do that at PACE because they already have a cadence where they meet, right? So really trying to understand that cadence and how to best use it is going to help somebody who is new understand and be able to be successful at PACE.
Yeah, that's true. It's so interesting and it amazes me every day. I feel like there's always something new to learn about pace, and there's always another technique or another way to enhance how your, current pace is connecting with community-based organizations or just getting in contact with other people. So I feel like we're still in the beginning stages, like where we're really trying to focus on that. And I love that we've reached 200 programs recently. And so that kind of leads me to my next question. So now that we've got all of these new programs coming in, what advice do you have for some of these newer individuals, that are just starting out in PACE? Like they might be very experienced with healthcare and all of those types of things, but if you had to give like one piece of advice to somebody new, what would you say?
I would say get very familiar with the regulation, and if you're not an individual that like to process a lot of documentation, connecting with other individuals that like doing that. My At IH, one of my besties at work, Anita Vang, she's amazing. To gotta give a shout out to her. But she is in QI, and she taught me a lot about what is the pace regulation, which are there are a lot of rules. And then previously, I also worked at IH with Ava Elser. She's our compliance, so definitely everything is like, are we allowed to do that? And but it was amazing to kind of grow with them and learn. And so, for me personally, I think for a new pace, don't stay with the status quo. Learn the regulations so that we can kind of expand the business. I've seen I think at a lot of NPA, when people say like when you've seen one pace, you've seen one pace, right? So every pace runs a little bit differently. They're all very unique and really respond to the participant community that they have. And so I want to say, if you're new, really look into exploring, especially if you have ties to like an FQHC or any other health center. Really kind of explore that relationship to not be redundant, right, for the participant.
I want to go to my next question. And so I know we've talked about like what are some things or like what advice do you give people? What are some things that you would say people don't expect about pace? Or what do you think is the common trend of something that people in the space still might not really fully grasp?
I would say one thing that may be really surprising about PACE is how closely you're going to have to work with your coworkers. I feel that is in the traditional, I mean, in an FQSC, some FQs are smaller. A lot of FQ that I started out, you still got to know your coworker and things like that. But I don't necessarily know like what they do in another department, like behavioral health. What is behavioral health doing? I'm not really sure. If I stay in medical, right? So sometimes, and when you're the in between person, then you know, but if you don't, then you just know one thing. But at PACE, you kind of have to understand how everybody else does their work, because the beautiful thing is, like, one of the examples that I like to give is, as a nurse, when I go to IDT, I get to learn how another discipline addresses the same problem in a different way. Is it redundancy? No, it's not, because the way that certain way that they approach it is not necessarily how I would approach it, but we cover different aspect for the patient. So for example, OT, traditional OT, is kind of working with the patient, but one of the OTs that I work with, she also worked with diabetes. And because she works with focuses on lifestyle changes, which is amazing, right? So nursing, we're providing certain education when it comes to medication and how to, make sure you take care of yourself. And then OT kind of walk the patient through on a day to day on like what they can do to actually, increase their physical activity, increase their capacity, things like that. So it's amazing, and it's really intricate, that you kind of need to understand and work closely together with other discipline so that you can actually provide a comprehensive care.
I love that because PACE is all about comprehensive care and patient-centered care. And so it's really just leveraging all of those perspectives. And so I'm really glad you also said that because like I'm thinking about putting my enrollment hat on. Like we attended IDT meetings and honestly at the time we were kind of like, okay, like we're going to talk about these specific people that were presenting for like the level of care and all of those things specific to California. And so just for people that aren't too familiar with like that specific part. And so like we attended just to really understand, okay, how is everyone else viewing this prospective participant or current participant in a way that we might not have, or something, or perhaps there's a gap that we're not seeing. So like, for example, there might be some teams that are doing home visits themselves or all of those types of things. So, from a clinical perspective, like what are some important questions for me to ask? Like, what are some really important pieces of information that I should be gathering from the family in order to get that full perspective that we may be missing, right? And I mean, we know seniors and even ourselves, we're not necessarily like the most accurate source of information pertaining to our medical history. I mean, you could ask me anytime and I'm like, oh, I mean, I think so. I'm not entirely sure. So when we're dealing with the senior population, yeah, I completely agree with you. Just getting those different perspectives is just so important. And so now I'm kind of going to segue into, now that you're not in PACE anymore, I want to talk about how PACE has left its mark on you, right? So can you share a moment from your time in PACE that's really stayed with you?
I love my experience at Pace, and I don't know if I have one particular moment, but
Mhm.
I really enjoy my experience with Pace, and especially working with our CMO, Dr. Miles. He's has been great, and what has really been a mentor, and kind of taught me a lot about Pace that I didn't know. So I find myself in an FQAC world when my staff we work with a lot of grant, so my staff would come up to me and say, we would like to roll this out and that out. And a lot of time I find myself saying, oh, we did this at Pace. Like we have a similar approach at Pace. So I even as with my FQAC right now, we are fortunate to have grant that allow us to have patient navigator, case managers, Cal AIM really supporting our patient population. And so I find myself kind of guiding them toward having like meetings where they can do almost like a small IDT where they can like
Mhm.
share information. And definitely my CMO, my CEO, and myself as Sutland, we are a big believer in kind of cutting down the barriers. And for a lot of patients having to go to another facility, see another doctor, is quite challenging. Transportation is one, but the paperwork, the requirement, coverage, understanding, and they don't necessarily have a patient navigator at another site. So we try to kind of do a one-stop shop. So
Mhm.
Southland has been evolving great. It was since I'm when I was there before, I actually came back to my FQ. So Southland has been growing a lot, and we actually purchased a new building that is going to increase our spacing just so we can have multiple specialties kind of under one roof. So I definitely feel like Pace left that mark on me of doing whatever you can to remove the barrier to care for patient.
I love that. It sounds like everywhere you go now, there's some kind of connection to PACE, right? That always just
Yes.
kind of makes you think about, okay, how did PACE do this? Or like, what did we do in PACE that I could leverage here and all of those types of things. So I'm glad to hear that that's coming from like the FQHC side because they have done amazing work in general just with the community. What do you hope people feel after, hearing our discussion, hearing your responses? Like, what are you hoping that people get out of this?
Didn't know Pace quite well when I started. I loved the model, and I just really wanted to learn more. And so that was my entrance to Pace. Plus, shout out to Tim Evinger for dragging me along. So he was the one that brought me into the Pace world. But I honestly feel like folks don't have an understanding, so they're thinking like, what does that involve? Like, I don't really want to step out of my current healthcare space and into pace where I'm unfamiliar. It sounds like there's a lot of paperwork, which sometimes it could be a lot of documentation for sure for assessment and things like that. But I would highly encourage people to join a PACE to start, step into PACE, working with a PACE organization, because it's so satisfying. You're able to kind of see the progress, the care. You're able to find out, like sometimes, in FQ, we try our best to let our provider know what the patient's progress with outside specialties, things like that. But with PACE, is right there next to you, right? There are so many ways we can secure medical records to go to the next step, really comprehensive about a care. To me, as a clinical person, is very, very satisfying. And then as an informatic person, I love it because I'm able to have all this data on the person and like the trend. I can tell you like who's likely to show up to their appointment, and what barrier they might have and things like that.
Mhm.
And just the aspect of having like the driver go pick up the patient and be able to tell you, hey, this person is not behaving the same, maybe you should do an assessment. That's amazing. That's like having extensive family route everywhere.
Oh yeah, definitely. I love the way that you said that. I feel like transportation especially plays such a big role into all of the services that, PACE provides, but the fact that they're just so familiar with that specific person that it's like, wait, Barbara might be a little bit off today, maybe she should get an appointment or something. So to your point, just being able to provide that care right when they need it. And so going back, so for all of the individuals that are lucky enough to have a PACE in their specific area, they should definitely go visit, see what opportunities are available. But what about for those that don't have one?
So the requirement for a PACE I know is very, very extensive. And if, we're always looking at having more PACEs PACE centers is really not a competition because there are just so many people that could use, that level of care. So I feel that if you're lucky enough to have PACE or multiple PACE in your area, really kind of explore and see if becoming like a community health provider is an option. Not necessarily open your own PACE or anything like that, but you can definitely kind of connect with a PACE, existing PACE, and kind of work with them and see, what kind of services can we provide. So for a certain FQ, I know they also, even if it's not their own FQ, they can leverage services like dental, optometry, and things like that that exist within the FQ. Other than that, if individual are interested in opening a PACE, I would say learning and actually putting the PACE system to work takes some finesse. And so there are opportunities like working with organization like Unlock, for example, really kind of help you set that up. And even if you have an existing FQ, kind of start making some changes to provide similar type of care, like an approach where you may have a mini IDT or IDT that doesn't meet as often, but you still have some sort of connection with folks. I think that is good guidance, anyways, because I feel like the PACE system really should exist. I mean, for everybody, but I understand there are some limitation into like fundings and things like that. But it's a good approach, and so even if you don't have a PACE, start working like a PACE. That would be my recommendation.
I love that you use the word finesse. That's definitely like one of the best words to use. So I appreciate you talking to me, taking the time to really emphasize your story. Is it all right if, if someone watches this and they just want to learn a little bit more about you, that they reach out to you?
Yeah, definitely. Feel free to reach out to me. I'm happy to grab a coffee, uh, jump on a call if you're not in the same state. But I live next to Disneyland, so you should visit, really.
Well, Caroline, thank you so much. I appreciate your time. For those who have taken time to watch with us, I appreciate you joining us. Really, this is just an opportunity for us to meet the people behind PACE, whether or not they're currently in PACE or they've recently just got out of PACE. If you have any questions or if you want to connect with any of the people that I've brought on, feel free to reach out to me.